Hi everyone, my name is Dylan, and today I'll be talking to you about different kinds of phobias. So many people claim to be afraid of spiders, but have you heard of anyone that's afraid of puppies? No? I want you to meet a guy named Marvin Cruz. He's a heavily tattooed 47-year-old bodybuilder and member of a biker gang, and he has a very, very severe case of cynophobia, which is the fear of dogs. For over 40 years, Mr. Cruz would continually avoid seeing dogs, to the point where if he does see a dog, he goes back home so that he's far, far away. Whether or not that's a couple miles away from home, down the block, he immediately goes home whenever he sees a dog. And in an attempt to face his fears, Mr. Cruz was asked to pet a puppy with the help of a therapist. So when he approached the puppy, Mr. Cruz began to cry due to the severity of his cynophobia, his fear of dogs. And although many of you might not necessarily be afraid of puppies, chances are you're afraid of something. Learning about the many different kinds of phobias will hopefully provide you a better perspective of what fear can really look like, more so than what our perspective of fear now is, just how deeply it can affect someone when it's as severe as what a phobia might be. Phobias are mental stigma which causes intense fear and extremely inhibits normal function of those affected by it. Today we will learn more about what phobias are, common and uncommon kinds of phobias, and what treatment options looks like for those who are affected by phobia. According to the Mayo Clinic, a phobia is an overwhelming and unreasonable fear of an object or situation that poses little real danger but provokes anxiety and avoidance. So individuals with phobia, what often happens is that they have to go through great lengths to avoid what they're fearful about. So it's not necessarily something that they attempt to deal with at all. They just try to kind of shove it away and avoid it, just like Mr. Cruz did with his fear of dogs. And according to the German Research Foundation, being confronted with fear-relevant information often increases the anxiety, which then in turn increases your desire to want to avoid what you're fearing. So for example, something that happened with Mr. Cruz was during his first steps during his therapy, he would be shown pictures of puppies. And immediately he just wanted to turn away. And to kind of counteract his turning away, they would ask him to hold his daughter's hand while he was looking at the pictures, so he had some kind of support system to go through the painful process of looking at pictures of puppies. Approximately 1 in 43 US adults have some form of phobia, according to Right Diagnosis, which is an organization that deals with diagnosing different kinds of phobias. And with these numbers, it's kind of interesting to see that dynamic of how what we might be confusing our own fears with an actual phobia, or people might be confusing having a phobia with just having a simple fear. As phobias can go much deeper than just being afraid of public speaking. It could be to the point where I need to walk out of the room as I'm talking right now. So according to an experiment done by psychology students at Louisiana State University, individuals with way more anxiety have an increased sense of fear. So like, as I said, when you have that increased sense of anxiety, you want to, that desire to avoid what you're fearful of gets increased as well. Phobias can be categorized into 3 different types: specific phobias, social phobias, and agoraphobias. Specific phobias are about specific situations or things, like cynophobia, the fear of dogs. Social phobias are fears of being in social situations, which mostly deal about fear of talking or fear of having to deal with other people or meeting other people. And agoraphobias are fears of no escape or feeling stuck. So someone that might have claustrophobia would be categorized as an agoraphobia. With a better understanding of what phobias are and what they look like, let's take a look at some common and uncommon phobias, and maybe you might be able to relate to some of these, and some of these you probably won't be able to. Common phobias: aquaphobia, fear of darkness; acrophobia, fear of heights; arachnophobia, fear of spiders; claustrophobia, like I said, fear of confined spaces; glossophobia, fear of public speaking; necrophobia, fear of death or dead things; and pyrophobia, fear of fire. Now let's look at some uncommon phobias. Phanphasmophobia, which is a fear of being touched; arithmophobia, fear of numbers, so that's probably not good if you're an engineer; barophobia, a fear of gravity; bibliophobia, fear of books; androphobia, fear of men; gynophobia, fear of women; venustrophobia, fear of beautiful women; cacophobia, fear of ugly people; erythrophobia, fear of stoplights; geniophobia, fear of chins; and lepophobia, fear of things being placed to the left. And there's literally hundreds of different kinds of these really specific phobias, some dealing with being afraid of walking into a certain class, being afraid of being stuck in a room, being afraid of sitting, and so many different kinds of phobias that I didn't even know existed. And we see again that some of these are definitely more common than others, but regardless of how much it's prevalent or how much it's not prevalent, we need to be able to see that there are options for treatment because it can be severe for those who have to deal with these phobias. Two kinds of medication is very common when it comes to dealing with phobias. Beta blockers, which block stimulating effects on the adrenaline on the body. Antidepressants, which act on neurotransmitters to influence mood so that they're not as so that patients don't tend to want to fall into that anxiety again. Also, psychotherapy is another way to medicate those with severe phobias. Exposure therapy, so repetitive exposure to a person's fear with guidance. So for example, what happened with Mr. Cruz, where he had to be shown pictures of the puppies multiple times and be exposed to puppies multiple times to deal with them. And behavioral therapy, where they learn to cope with their fears through alternative perspectives. So for example, with Mr. Cruz, he'd have, instead of being exposed to the puppies, they'd kind of give him a new perspective on what puppies are. So saying that puppies are kind and cuddly and they're not evil like you think they are. And in conclusion, with phobias often misunderstood as simple fears, we have learned about exactly a little bit more about what they are, what common and uncommon phobias are, and what treatment options can look like. Although phobias might be difficult to cope with or learn to face, if you seek professional help, there's definite ways that you can deal with them much more easily. If you're someone you know is being affected by phobias, I hope this newfound knowledge will help you and others face your fears in the near future. Thank you.